Hello, it's Dr. Elisha Van Dusen with New Hope Chiropractic. It's estimated that scoliosis affects anywhere from 2 to 3% of kids and adults in the U.S. That's roughly 6 to 9 million people. While it seems to develop most commonly within a specific age range for boys and girls, it can also develop in infancy. Every year, about 30,000 children are fitted with a scoliosis back brace, while 38,000 people have spinal fusion surgery to correct the problem. Scoliosis screenings can have a real benefit by identifying the risk factors for scoliosis and also making way for early treatment. The earlier you detect the scoliosis, the easier it is to treat. Scoliosis typically develops in childhood. For girls, it's usually between ages 7 and 14. Boys develop it a little later, between 6 and 16 years of age. Getting a scoliosis screening each year during these critical age ranges allows doctors to identify the condition early and then begin treating it before it gets serious. Advanced scoliosis can require extensive treatments, bracing, and even surgery. Chiropractic really has been shown to help scoliosis a lot, as do stretching, special exercises, and then also sometimes physical therapy. There are spinal adjustments that chiropractors can do that are very specific and specifically help treat the scoliosis. When looking at the condition early on, you can measure something called a Cobb angle, and this can be stopped from progressing and even reduced so that the spine can assume a more natural curve. Non-surgical treatments tend to be much more effective in the earlier stages of scoliosis, so early detection, early diagnosis is key, because you want to do everything you can to avoid a very invasive scoliosis surgery and putting rods in and fusing your back up. Identifying high-risk cases early can address current issues and prevent future ones. So, as a chiropractor, I can identify certain scoliosis risk factors in children before the condition even develops, and then the scoliosis screening allows us to spot tension in the child's spinal cord, which is a common sign that will develop into scoliosis. When parents know that their child's in danger and in a high risk category for getting scoliosis, they can take proactive measures with home monitoring for the signs of scoliosis and keep up with recommended screenings. They'll know to look for the signs and can address them quickly, so you can treat the scoliosis at the earliest possible time. So the early stages in development of scoliosis are still shrouded in mystery for a lot of researchers and doctors and general public too. While there's been some development made in better understanding the condition, there's still a lot left to learn. There have been many studies that have aided doctors in identifying high-risk children and making early stages and diagnoses of scoliosis possible, like how do the angle in foot, for example, are linked to scoliosis. Screenings, diagnosis, and treatment are really important to maintaining proper data for more studies to be conducted and more research to be done. So avoid the waiting game of seeing if the scoliosis will progress. And while parents may suspect a problem or know that a problem exists, they may take a wait and see approach in getting treatment, but it's best to get a screening done early, get some x-rays done too. And if the curve worsens, then in a very short period of time, then you know that treatment is vital and very important to do as quickly as possible. So if you have a child that you think has scoliosis, you think there's some of the signs present, like for example a high shoulder or a high hip, or they're walking funny or sitting funny, then you might be a candidate for getting a scoliosis screening as quickly as possible, and even possibly some x-rays. So if you know anybody like that, contact us as soon as possible, and then we can, if they're at risk for scoliosis, get them the treatment they need as soon as possible. So check us out at newhopechiropractic.com, and with that, have a healthy day.